Thank you, Mr. Iacino. Mr. Vivona, do you have anything to add?
No, not at this time.
Thank you. Ms. Gutierrez?
None.
Thank you. Anything from finance?
Not at this time.
Anything from the LAO's office?
Sean Martin with the Legislative Analyst's Office. We're recommending approval of the governor's proposal for $378,000 in 3 positions to provide additional oversight in Los Angeles County. We think it makes sense to address the issues identified by the Federal Centers for Medicare and Medicaid Services and to mitigate the potential loss of further federal funds. With regards to the governor's proposal for $2 million in special funds, again, we're recommending approval given the urgent need to address quality issues identified in the licensing and certification program. We believe that these additional funds resources are warranted and it's a sensible short-term approach. With regards to the governor's proposal or request for $19.8 million in 273 positions, we're withholding recommendation pending the report that will allow us to determine whether positions other than health facility evaluator nurses can be used in order to complete this workload. In the absence of that report, we're not able to tell you whether the staffing that is proposed in this governor's proposal is the most cost-effective approach. We also note that 64 positions out of the total proposed are 2-year limited term positions, many of them health facility evaluator nurses. It takes up to a year to get a health facility evaluator nurse fully trained and functioning on their own, doing licensing and certification and investigation work. So when you have a 2-year limited term position, if you're spending the first year training them and the second year they're actually out doing work, we question whether this approach makes sense. With regards to the proposal for Los Angeles County for $9.5 million to augment the contract to fund 32 new positions and also to bring some existing positions salary levels up. Again, we're withholding recommendation on that pending the report that's overdue on the health facility evaluator nurses. And we're also recommending that the legislature require the Department of Public Health to incorporate meaningful performance measures and benchmarks into the Los Angeles County contract. And we recommend that this contract only be approved for a 1-year period. As you've heard, there's a lot going on here. We're adjusting our funding and staffing formulas, and we think it makes sense to revisit this issue in 1 year and take a look at how well Los Angeles County has done in terms of filling the positions that they're requesting money for, and also in catching up on some of the workload where they've fallen behind, and then reevaluating the performance measures and benchmarks at that time.
Thank you. Just one question for me, Ms. Iacino, if you would. Would you give 2 or 3 examples of the most common complaints that are investigated, or that are complaints that are made, I should say?
I don't know off the top of my head most common. I'm going to turn to my colleague Scott Vivona, who has more field experience than I do.
Well, it's hard to say without being prepared to look at the data. We do get a lot of
Highlights, just highlights.
We get a lot of care issues. That forms probably the bulk of them. And care issues can be parsed out into a lot of different types of issues. So we get a lot of care issues. We get some staffing issues that come up. That's a pretty frequent complaint. So it's primarily broken down into the care issues. And like I say, it could be abuse type of care, or it could be your care plan is not being adequately monitored. So those are generally kind of where the complaints will fall from.
And I just wanted to have a sense. I don't want to trip you up. If there are things happening to folks, I want these investigations to take place. And if staffing is needed to do that, I don't want to stand in the way of that. I do have just a concern that to know what the nature of the complaints are, because I hear all the time that there is poor care or mistreatment of patients as a result of ratio of staff to patients, and that there are just too many patients for the number of staff who are in some of the locations and facilities that ultimately get investigated. And I just wanted to hear what the department's experience is with that, and as these new staff are brought on board, how well they will be in a position to specifically address those concerns.
So when we look at a quality of care issue, we can, and we'll be up with Department of Healthcare Services later to address the question is there as well. But there is a staffing standard, and we do conduct separate audits just for the staffing hours. But we also, that's the standard, the staffing hours is a minimum standard, and facilities are required to staff adequately to meet the needs of their patients. And so if we are investigating a complaint and we determine that something did happen, we are able to cite the facility for a deficiency for not only for the bad outcome, but also for failure to staff adequately to address their particular situation. So for an example, a facility might have an outbreak of influenza in the facility. And so many of the residents who may, on a general day, need a certain level of care, when many people in the facility are sick with influenza, they're going to need some more staffing. And that's the responsibility of the facility to assess the needs of their residents at all times and to assure that they're staffed adequately to address those needs.
And is there a report card of how facilities do with something like what you just described, which just seems more situational or conditions change, whether it be influenza or something else? Is there a report card that is put out so that your department and others can be clear on how facilities are doing in making those adjustments, if you will?
Not specifically to the staffing. I mean, that we would be out, like I said, when we're out on a complaint investigation, or if there is a disease outbreak in a facility, we'd be looking into that, and we would be evaluating them based on that individual situation, whether staffing was adequate at that time and whether the residents were properly cared for. But we don't have a general overall report card on that.
I will add that CMS does have a metric on their 5-star rating systems, and one of the components is a staffing component. So there is that evidence or that information that is displayed on the federal website.
Let's hear from the public. Public comment. Thank you. There'll be 1 minute each.
Thank you, Mr. Chair. Gary Passmore, Congress of California Seniors. Very quickly, I've been coming to this committee for hearings on this issue for over 12 years now. And it has been a problem all 12 years. This isn't a result of recent funding problems for the state. The same issues keep coming up. The contract with L.A. County, the number of vacant positions, the levels of turnover and low retention rates. And I also keep hearing, as you do, that complaints lead nowhere. Some of them take years to resolve. And in the meantime, some of the frailest people in California are being neglected or abused or die. And all I can do is pray that you and your members will address this problem, take on the issue, and get it resolved. Thank you.
Thank you.
Good afternoon. My name is Cynthia Harding, and I'm the interim director for the Los Angeles County Department of Public Health. The Los Angeles County Board of Supervisors supports the governor's budget proposal for fiscal year 15-16, augmenting the Los Angeles County for $9.5 million and providing additional staff. We've been a contractor of the state since the 1960s. And the board, their first and foremost priority is the protection of the residents in those facilities. Our current contract ends on June 30th, 2015, and while we appreciate the 9.5 augmentation, it falls short of the county's need based on the state's own staffing model. The state staffing model used the incorrect salaries, incorrect employee benefits, incorrect indirect, and incorrect county productive work hours in coming up with the estimate. The minimum mandated services outlined in the governor's budget proposal, again using the state staffing model, would be $4.8 million above the $9.5 million for a total increase of $14.3.
Could you please make your final comment?
Yes. And the county would need a firm commitment in the next contract with the state to resolve the chronic underfunding issue, and a firm commitment to allocate resources to cover the workload that LA County would not be contracted to do in order to take care of those vulnerable residents. Thank you.
Thank you.
Good afternoon. I'm Terry Williams, also from Los Angeles County. I am Department of Public Health Environmental Health Division, and last April the Health Facilities Program was put under my leadership in order to both review and try to make improvements to the licensing certification program. With the release of the governor's budget, I'd like to make 2 points very quickly. The first one being that with the augmentation of the additional 4.8%, to do the work we are currently being held accountable for contractually with the state would require 331 FTEs according to the new state model. We're currently funded for 151. That falls right in line with the 33% and the less than 15% budget, which is also less than 100%. There's a 119% shortfall currently in both funding. The other thing that it points out is it gave a 48% increase in staffing in the proposed budget with a decrease of 30% workload, once again confirming just how understaffed we have been over the last 3 years. Thank you very much.
Thank you.
Beth Capel on behalf of the hospital workers and nurses of AFSCME. Much of what you've heard and will hear today has to do with nursing homes, but the failure of the department to enforce in hospitals, even with the augmentation that is proposed, is more severe. They do not survey for compliance with the nurse ratios. They have, as of this morning, according to public records, never fined for lack of compliance with the nurse ratios. And I have 3 nurses with me who will speak to their failure to enforce the nurse ratios when nurses complain to the department.
Thank you.
Hello. My name is Teresa Castine, and I am an intensive care unit nurse at Kaiser San Diego Hospital for 18 years. These are the sickest patients in the hospital. The patients today, compared to when I started, are sicker and more complicated to care for than when I started. My unit is chronically short-staffed. What this means for patients is that they often do not get their medications when they should, and often they do not get their pain controlled the way they should. The other day I saw a patient of mine who had gotten out of bed by himself. He had pulled out his IVs, his intravenous lines, and all his monitors. He was in his 70s, and he could have easily fallen and broken his bones. We need the ratios enforced. Thank you.
Thank you.
Hi, my name is Megan Joyce, and I'm a registered nurse at Parkview Community Hospital in Riverside, and I work in a mixed unit of medical and telemetry patients. Patient safety and avoiding critical events is always a top priority for me, but also providing quality care where patient education is incorporated throughout the stay is also a very high priority. When nurses are over-ratioed, it leaves time to barely complete basic care, leaving out quality care and education on disease process, medication regimen, and also things like the importance of not missing dialysis and checking your blood sugar levels frequently for a newly diagnosed diabetic. The patients and families desperately need these tools, not only for their overall health, but also these educational pieces will help prevent unnecessary readmissions. Securing and enforcing patient ratios ensures nurses will have time to provide quality care where patients and families leave the hospital with the tools to manage their care and prevent unnecessary readmissions. Thank you.
Thank you.
My name is Lisa Hahi, and I'm the hospital president of UNAC UHCP Nurses Union. I represent almost 2,000 members, and every day I see the units that are chronically short-staffed. When nurses report to me that they've called DHS for enforcement, nothing has been done that I can see. Nurses routinely have to make a decision. Whose pain med will I give late? Who will not go to the bathroom when they need to? Who will I not educate on how to care for themselves at home? In addition to hospital president, I am also a telephone triage nurse. And the other day, I had a patient call me with an extremely high blood pressure or blood sugar who had not received any discharge instructions on how to give insulin. I had to refer them to the emergency room. When I round on the floors, nurses frequently come to me in tears. The other day, a nurse told me something I will never forget. At the end of the day, I know what my patient deserves, but I know what I was only able to do.
Thank you.
Good afternoon, Mr. Chairman and members. My name is Bill Barnaby. I'm here on behalf of DaVita Healthcare Partners to speak to the need for timely surveys of the new dialysis clinics. In order to meet the increasing incidence of kidney failure in California, timely planning for new dialysis clinics is essential. Once constructed in compliance with relevant building codes and local zoning rules, dialysis clinics cannot fully operate and treat patients until approved for state licensing and Medicare certification by CDPH through the L&C program. A number of finished clinics, usually with staff, set idle until surveyors visit to okay the license and later to approve the Medicare certification. Delay means that these people may not find a dialysis clinic that's available to them. This is a life-threatening situation. We have to plan for the future. We've worked well with the department in the past, but they need more surveyors. And ESRD surveyors take longer time to train than any of the other RN surveyors. We respectfully request approval of the budgeted staffing positions. Thank you.
Thank you.
Mr. Chair, I'm Brandon Tartaglia with Disability Rights California. We support the idea of the licensing division receiving additional resources to expedite the backlog of citations, but if they're going to get that additional money, we think there should be some time frames for how long those investigations can take. We've proposed a very measured approach that you could see in your agenda, asking for the department to, at the very least, complete the investigations into the most egregious incidents in a certain time frame, those involving death or serious bodily injury. These are less than 20% of their total investigations workload, and they're the most likely to be delayed. We've seen some investigations involving death take as long as 7 years. And we've seen other incidents where deficiencies are left untaken care of while other people are left to suffer the same fate. In one facility, a 4-year-old boy died when he pulled out his breathing tube. And while the investigation, which took 3 years to finish, while that was going on, another 3-year-old girl died of the exact same thing in the same facility. So we think these things are avoidable, and we hope that you'll support our proposal, and we look forward to working with you and the administration to make that happen. Thank you.
Thank you.
Jennifer Snyder on behalf of the California Association of Health Facilities. We also do support the governor's proposal to infuse more dollars into the licensing and certification division. We think we have been longstanding supporters of legislative efforts, both fiscal and policy bills, to support increased funding and to specifically come up with time frames and efficiencies within the department going forward. Half of the complaints that the department works with are facility-reported incidents, which are unusual occurrences, where at this point are not clearly defined. So facilities are reporting numerous and thousands of different facility-reported incidences. So we'd like to get that clarified. And we'd encourage the legislature to actually create measurable goals that will go along with these new monies, one being timely completion of investigations, 2, coming up with our definition of what we should and should not report, and 3, some efficiencies where you have a surveyor that starts the complaint. Maybe that same surveyor should finish it, and it should be done fairly quickly, not within like 3 to 4 years. Thank you very much.
Thank you.
Good afternoon. I'm Yolanda Moore. I am on the front line of licensing and certification. I work as a supervisor of health facility surveyors in LA County. I am a member of SEIU 721. I have over 35 years of experience in public health in LA County and 28 years with the licensing and certification program. I've dedicated my life and work to putting patient safety first, health and safety first. My colleagues and I in LA County are responsible, as you know, for oversight of 1/3 of the state's workload. This includes over 37,000 skilled nursing facility beds. We take our job seriously. My colleagues and I are fierce patient advocates. We know that the frail and elderly residents and their families rely on us to be their eyes and their ears to keep them safe. And while we've seen tremendous overall improvements in nursing homes over the years, chronic underfunding and the related short staffing has stretched our program very far. We're almost to the breaking point. It's incredibly frustrating to go out and try to do a thorough and careful investigation only to have it backlogged due to a tremendous lack of staffing resources. LA County has been especially impacted as we get fewer than our share of overall program dollars.
Could you make your final comment, please?
Sure, final comment, I'm sorry. For example, the staffing shortages that we see when we go out into the field result in patients being left unchanged, soiled for long periods of time. Patients wandering out of the facility, suffering harm to their person, requiring care and treatment in acute care hospital settings. We just need to look at this and look at it from the front line, and we're representing the patients and the families.
Thank you.
Good afternoon, Chair and members. Michelle Cabrera with SEIU California on behalf of both the LA County and the statewide residents, members, who do this work. We are extremely heartened by the progress made by the state in this January budget proposal. In the spirit of this proposal, however, we feel that LA County does need to be brought up to Tier 1 and Tier 2, which they believe is about $4.8 million short, as you've heard. The state should also make a long-term commitment to the full program. As referenced, this goes beyond Tier 1 and Tier 2. There needs to be a long-term approach to this and investment. That's why something like the one-year contract that's been proposed will be unworkable, simply unworkable. The county, the state can't say in a program where it takes a year to train someone that you're only going to be trained for a job that might be around for a year. That's just going to be a problem with both recruitment as well as retention. It's impractical. We need to make a long-term commitment to this program. We understand that there needs to be a phased-in approach. We understand that there needs to be better oversight. And one more thing, the workers need to be brought to the table in a more robust way in informing the kinds of reforms that are being proposed here. The Hubbard report found that they are the backbone of this program. They are committed and caring experts. They know this stuff backward and forward, and they need to be engaged in order to do the training to make the reforms real that we all want to see happen. Thank you.
Mr. Chairman, members, Theo Pejos, representing Tenet Hospitals. We have 12 hospitals statewide, both in the Modesto area and the Coachella Valley. We're essentially the main Medi-Cal provider. I'd just like to say, first of all, that we have found the department is a highly professionalized staff. They tend to be very good at what they're doing. However, we note the lack of resources and some of the staffing challenges that they've had to encounter, and that has led them to some unfortunate delays in their enforcement programs relative to ongoing investigations. So we'd like to associate our comments with some of the comments made from the long-term care community, from the disability community. We believe that the full funding of these resources is necessary for them to execute their job. We think whatever timelines that you put in there for long-term care facilities should also be replicated in the Health and Safety Code relative to hospitals so that enforcement happens in a more timely manner. Thank you.
Thank you.
Good afternoon. My name is Kimberly Coart. I'm the current chair of Bargaining Unit 17. That is the registered nurses that work for the state of California, including California Department of Public Health. Overall, we are pleased about the state's proposal to invest in more staffing for licensing and certification, and it's an important first step. However, currently we're unsure that the 237 positions are sufficient enough to address the current and future cases. Currently, the state HFENs do go into LA County to still do surveys. Currently, as we speak, I actually had a meeting with nurses in Richmond, and who actually told me they had just come from a survey in LA County. And also to address the workforce issue, the 16 nurses that I met with in Richmond, out of the 16, 12 had been there less than 3 years. So when you talk about the 64 limited term positions, they really should be permanent full-time position, because like the gentleman said, it does, and they have told me themselves that it takes upward to 2 years actually to be acclimated to this job, and the amount that it costs the state to actually train the HFENs. I've heard from the state it's 40,000, but the HFENs said it's closer to 100,000. So, thank you.
Thank you.
Selena Pryor-Dansby with SEIU Local 1000. I wanted to echo the comments of my colleague that spoke before me, and just ask that you would really consider that our members are underpaid and overworked, and they are completely frustrated with what's happening. So I would just ask that you keep that in mind when you're listening to the comments that the department is making and my colleagues that have gone before me. Thank you.
Thank you.
Karen Jones, Long-Term Care Ombudsman Program from San Luis Obispo County. And I have two quick comments. One is in my 16 years, I've seen an awful lot of very hardworking licensing staff. And I've also seen budget ebbs and flows and resource ebbs and flows. And whatever fixes become licensing at some point soon, that they would be permanent, that they would not continue to keep these ebbs and flows. Their population that they serve, the seniors in care facilities, don't have the resources to make up for their lack. So whatever fixes happen, they need to stay permanent. I'd also ask that when you're looking at voting, that there's about $600,000 in reserves still in the citation penalties account, and that you consider that for the Long-Term Care Ombudsman Program. Thank you very much.
Thank you.
Hi, I'm Krista Chelomidis, Senior Advocacy Services Ombudsman Program, and also HICAP. And I wanted to support Karen's position on the $600,000 for the ombudsman. And I'd just like to point out that there is any ombudsman in this room could answer your question in regards to care issues and what our complaints are in regards to going up to that we're sending up to DPH. And I'm happy to share with you a couple. Resident-on-resident conflict is a big one. Lack of care plans, the lack of the failure to follow a care plan. Discharge issues, discharging to homeless shelters. I mean, I could probably do this for an hour, which I don't want to, but to give you the top three. So please support the Ombudsman Program.
Thank you.
Good afternoon. My name is Tony Chicatel. I'm a staff attorney with California Advocates for Nursing Home Reform. I'd like to first thank the committee staff for what I thought was an excellent review of the long history of DPH dysfunction. Also wanted to point out we submitted a letter to the committee on March 6th and urged the committee to read that. We don't think this plan is going to work. This was done 9 years ago. About 150 staff people, investigators were added at that time, and we saw performance decline rather than improve. We're saying that this is akin to adding shiny new tires and rims to a car that doesn't run. The engine is busted, and the engine is leadership. Until Department of Public Health assumes or embraces its role as a consumer protection agency, we feel that all the inspectors in the world aren't going to make much of a difference to the consumers of licensed health facility services. We're all for increased resources for enforcement and oversight. We just feel that the way the department operates currently, increased resources aren't really going to get us increased enforcement and oversight. Thank you.
Thank you.
Hi, I'm Nancy O'Keefe with Ombudsman Services in Contra Costa. And you had a question about the three top concerns that agencies get. In Contra Costa, probably the main one is quality of care neglect. The residents end up with bed sores that are malnourished, dehydrated, pain issues aren't addressed, and so hope you consider increasing our funding. The other thing I wanted to say about licensing is I recently referred a complaint to licensing. It was concerns about weekends, and I was told that they don't make weekend visits, but as ombudsman we do. Thank you.
Thank you.
Good afternoon. My name is Lisa Coleman. I'm the Executive Director for the California Long-Term Care Ombudsman Association. And I wanted to identify the citation account, the skilled nursing citation account. It really wasn't discussed here today, but we did make it into your agenda. For the last 2 years, funds rolled over into the general account. So this was funds that were created from citations that were laid against skilled nursing facilities. And the Ombudsman Program has been asking for funds for years now. And we would ask that rather than having that funds go over to general funds, that money would be used to rectify the harms and support the Ombudsman Program.
Thank you.
Hi, thank you. Brooke Hollister, Assistant Professor of Sociology in the Institute for Health and Aging at the University of California, San Francisco. I actually wrote my dissertation on the Ombudsman program and will support everything that the Ombudsman representatives have said thus far. It can be a potentially very strong and powerful program. It's mandated to conduct systems advocacy, which makes it a unique program in that it receives federal funding to do that. But it has been severely underfunded in the state of California for quite a long time. When its general funds were cut, that exacerbated a lot of the problems, and for that reason, they haven't been able to conduct the important systems advocacy that are needed to protect those very vulnerable residents in facilities. And so, I'd encourage the extra funds in the penalties account to be allocated to the program. Thanks.
Thank you.
I forgot to say one thing. Yolanda Moore, LA County. We do go out to facilities and conduct surveys on weekends, and I personally am part of the group of supervisors that is on a 24-hour call. We do rotations of a 24-hour on-call, whereby the county operator would call us to respond to any emergencies if needed, or dispatch staff to do so. Thank you.
Thank you.